All right, so today I'm going to talk about suboccipitals. So over the past few weeks, I've had quite a few different people come in with problems with their neck, dizziness, facial numbness, you name it. And so I had somebody that got in a car accident that was dizzy. So what I wanted to go through were the soft tissue responses to this, because a lot of them went to the doctor couldn't find anything wrong, and so I was trying to explain to them that their body has this response. So when your body goes into a stress response, it doesn't matter what it is, there's a lot of stuff that tightens up. But when there is an acute trauma where somebody throws something at you, or there was an accident, or it could even be something like an acute virus, the body has these mechanisms to protect you and to keep you safe and to keep you alive. And when the more severe they are, the more the severe the response. So the muscles in the neck, especially sternocleidomastoid, are going to clamp onto their attachment sites: the skull, the clavicle, the skull, the vertebral column, the skull, the scapula, that shoulder blade. They're going to hold it all together because that needs to stay together in that acute response. It's autonomic. You don't have much to say about it. You're going to not even realize sometimes it happens. Say somebody hit you with a ball from behind. You don't know that it's coming. Without this mechanism, your body is going to pretty much, become very injured. So with that said, if you get hit from behind and you get that back going into that hyperextension, or if you get hit in the front and that head is moving forward, you're going to have different responses from the neck muscles. So depending on your life, depending on your lifestyle, depending on what you do during the day, all the different muscles are going to respond differently. So at this point in my life, my neck muscles are going to be different on each side, right? I might have a tighter sternocleidomastoid, looser on this side, locked along on this side. I'm not going to go into that fancy terminology. So if I get hit straight on by something from behind, my head may go back, but it may actually collapse to the tighter side. And that's where the problem starts, because we were talking about this in splenius group, that atlas, the first cervical to the occiput, the skull bone, where the foramen magnum is, where the spinal column comes through and the central nervous system with the spinal cord, that has to be at this beautiful balancing point for everything to work well. So if now you're like this, 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 I can't even do some of them, no matter what it is, hyperextension at C5, hyperextension at C2, rotation with lateral flexion of the neck, no matter what it is, you're going to have an imbalance at that point. And that's where all the brain nerves come in and control the entirety of the body. So like I said in splenius, we have to get that position back to square. 3 things. Number 1, we went through the lower back. That is absolute foundational. Go back and revisit those curved back, flat back. I'm working on lateral line right now, but you've got enough with the curved and the flat to get started, and then go to my primers, understanding my primers, because that's going to help you start to understand body movement. Number 2, the back arch and the neck arch should match each other. They should be slightly concaved. It doesn't mean they're going to be perfectly aligned, but they should be slightly concaved. So if the neck and the lower back, and take a picture of yourself sideways or have somebody do it for you, if they don't look similar, that means that there's an issue with them, right? So now you're going to have something to work on with your neck. The third thing is, I forgot. Oh my gosh. Well, I'm going to go for this. I'm not quite sure is where I was going to go, but the third thing would be understanding where the next dysfunction is. So you're looking at the curve of the lower back. I went through those. The curve of the neck is a little bit more complex. You may need somebody to help you with that because you could have hyperextension, which means your neck is caved in lower, middle, higher. I've seen flattening of the back where the skull meets the neck. I've seen a flattening there from people looking down. I've seen it hyperextended from people having a really crunched upper back, that kyphotic back. I've seen people that have one shoulder up. It's all over the place. But what remains the same is that you can still work on the most important muscle of the neck, what I call the primal body muscle, sternocleidomastoid. This is my favorite muscle. You know why? Because nobody remembers the name and I can just like roll it off my tongue. Sternocleidomastoid. Mastoid process, 2 divisions, one to the sternum, one to the clavicle. And that's how you remember it. Sternocleidomastoid. And that's its connection points. And the connection points are going to give you a clue as to its movement. So we can't draw it straight down. It's a turn and draw or a tip and lift or a lateral movement. So those are your primary movements. So what we're going to do today is with a bigger ball, I'm going to show you how to be proactive with opening up sternocleidomastoid because you can get thickening here, thinning here. This could be locked short. This could be locked long. It's a very intense muscle, has a ton of strength to it. Underneath, longus coli, the hip flexor of the neck. This neck flexor is intense. These can also crimp down on thyroid. So by doing this exercise, you're going to be proactive in keeping these open. All right, so let's hit the floor and do that now. So you just heard me babble a little bit about suboccipitals, and here is there's actually 8 of them, 4 on each side. If you look over here to the right, there's the 2 smaller ones, 2 big ones, and then 3 and 4, which are thinner and connected to C2, and then one connects up at the ridge to the outward part of that atlas. So I'm not going to get really specific because it's not necessary and I don't even remember them. But we do want to just look at their movement. Now their movement's a lot like splenius. Oops, I want to drop that down. So let's look at that again. So the suboccipitals look a lot like what we were looking at splenius, but when I did my splenius movement, I did it to the side because most of the problems I have with splenius are left lower. Suboccipitals tend to be much more in the area of the number 1 and number 2 right in here. They're usually in a locked long position. I consider these muscles postural, and when they're locked long, the occiput is in more of a drop down position. So people have a really hard time getting the back of their head to lie onto the table. Their that front sternocleidomastoid has changed positions. It's now short on one end, long on the other, and it's drawing them downward, their chin in. So we want to get that sternocleidomastoid to open up right at its connection point by the ear over here. And we want to get this area of the suboccipitals to sit into a more neutral position. So shortening them is looking up at the sky right there, that shortening. So that would be more hyperextension if it was in that position. But we want it somewhere in the middle of that. So by taking the skull back and shortening them, we're strengthening them and we're opening up the front. So this gives you a little idea of where they are. Now these are big headache muscles too. You know, they're not going to be a direct headache, maybe like trapezius, but they're going to be dull. They can also control sinus release. So a lot of people, when I go back there and I'll get some space between some of those muscles, it's not so thick, they'll actually say that they felt their sinuses drain back the back of their throat. They are very much in tune with eyeball movement. So moving your eyes regularly and doing eye exercises are also going to help keep them strong. So don't hesitate to try to move the eyes without the head and keep those eyeball muscles moving nicely. And let's just pause that. And so what this little series is me just kind of, when somebody comes in and has a problem, I'm telling them I'm going to make a video for them so that it's very specific, and then hopefully they build on each other. More than likely, you're going to have a few different scenarios. The first thing is obviously the lower lumbar. We want to look at the lower lumbar, the pelvis, and the femur bone as this unit that has to be really nice and balanced. And so that's foundation, because that's going to be holding up the torso, holding up the integrity of the body and the speed at which you move and how well you move. Then from there, I like going to the neck, because then we can get the back into a nice balanced position. Then we can start to work on the neck. And once we get the neck, the head sitting straight on the neck and the torso sitting straight on the pelvis, then we can start moving the two ball and socket joints of the hip and the two ball and socket joints of the shoulder and start getting them to get back to open again. Now, this is a very simplistic way of looking at anatomy, but I have been doing this for so long that simple is always the best way to teach people. So if you train yourself right now to look at your pelvic, lower back, and hip, like I talked about in those one video group, and now look at the neck, and you'll have two very important parts of your nervous system that are going to be flowing well, working nicely together. Everything else is going to start to have to shape shift to work around that. And then once we're done with that, we can work with the rotational aspect of those two ball and socket joints. And you're going to be very, very much your own perfection at that point. Everybody's very different, so your perfection is going to be different than somebody else's. So hopefully I can give you enough information. Now, the back of the neck also has a few other muscles. There's the spinal erectors, there's the trapezius that goes up there, there's the levator scapula that goes up there. And the scalenes wrap and go to the back of the neck too. So I'll probably put trapezius, levator, and spinal erectors in the same video, because they're a little bit more superficial and they're not postural. But scalenes is, I think I may have a video already on scalenes, and that muscle is probably the most problematic muscle that I have ever worked with. So with that said, now you're going to see the video of the movement of correcting this with a ball. All right, have a good day. All right, so this is like a kickball. It's really soft. This is the reason why I want it like this, is so that we can really arch the neck over the ball. So you're going to put the ball behind your head. So I have it right at the top of my shoulder, and it's coming up just above my head. And I'm going to be able to pull my head around the ball and into the ball. So find a comfortable spot. And if you need to, deflate it a little bit so that it does this, because everybody's necks are different lengths. But we're basically going to take the back of the head and we're going to pull it around and the ball and into the ball. The chin is going up to the ceiling, and then bring it down. Now, what are we doing? Reciprocal inhibition, right? We're contracting the suboccipitals, which, by the way, also are in charge of your eye movement. When your eyes move, your suboccipitals contract. And you're going to pull the ball up. So when I'm doing this, I'm feeling my sternocleidomastoid opening up right by my inner ear. So there's my first point of dizziness. If one is tighter than the other, it's going to affect the equilibrium from the ear fluid. It's also going to help identify which one is thicker so that it lets go a little bit on my front mastoid process to help get that skull in a better alignment. Now, 3 to 5, and you can hold them 3, 2, 1, and then bring it back. Now, we're talking about suboccipital muscles. So when we talk about neck muscles can be finicky. I had a case 28 years ago, 27 years ago, somebody who had agoraphobia, who wouldn't leave the house. She was dizzy. She would have to sit down outside, and it was legitimate physical, although everybody thought it was mental. I worked on her neck, on sternocleidomastoid, 3 times a week for 25 minutes between neck and hip, because there's a really big relationship there. 25 minutes between neck and hip, really gently, 3 times a week. It took me 6 months to get her back functioning after, okay, let's say this, 25 years of being stuck in the house because she was too dizzy to leave. It took 6 months to get this person back up and walking again. I've seen it all. So with that said, massage therapy is absolutely very, very important, but you can do your own massage. So let's look at the massage of suboccipitals if you don't have a massage therapist. So what you can do is you can take your fingers, hold your fingers like this on the back of your neck. Find with your first finger, find the point where your skull meets your first vertebra and just circle outward about 4 to 5 inches. And do that 3 times. And then what I want you to do is try to take your fingers and tip your head up a little bit more and do it again. So when you feel me do this, you'll feel me put my fingers in there and try to move your neck and your head so that I'm shortening suboccipitals and I'm opening up this. And I'm trying to set your occiput so that I get really nice flow from your nerves in your spinal cord down your neck before I start working. I want a neutral neck. I want to have a neck that's in a really nice alignment, because if you're like this or you're kind of twisted, it's not going to help me. So that's the best way to do it. Let me show you. So if you put your fingers here and just circle back behind your skull and then tip your head, and you can go in there a little bit more each time you tip your head. Now, this is one of those muscles that's my pet peeve, because when I try to put my fingers back there on people, they'll push their head into my fingers. And number 1, it hurts my hands. Number 2, you're contracting the muscle I'm trying to work on and relaxing, so it doesn't work. So you will feel this when you do it. If you try to push your hands, you push your fingers into that and you're pushing on your neck back at the same time, you're gonna feel those muscles get hard. So relax your head, let your fingers relax in there. If you have somebody that can do it, they would do it like this, holding onto, as if this is the head, they would do it this way rather than you backwards. So there it is. Hope this helps. Have a good one.